Hi, my name is Cassidi Dailey Kalejta, and I'm a genetic counselor at Geisinger.
I'm deRichemond. I am a nurse practitioner and clinical lipid specialist. In this session, we're going to talk about causes of high cholesterol and also introduce you to familial hypercholesterolemia, which means family high cholesterol. LDL is a low-density lipoprotein. Lipoproteins are part of the cholesterol. I refer to them as the lousy lethal cholesterol, the ones that make the blockages. The causes of elevated LDL can be genetic or non-genetic. Your primary care provider can look for the non-genetic causes of your elevated LDL, such as new diabetes, thyroid problem, a kidney problem. And then when we have genetic disorders, we can simply do that through testing to see if it is familial hypercholesterolemia, an inherited problem.
We know that there are certain genes that are associated with FH. If someone has a change in one of these genes associated with FH, that means that that gene isn't doing the job that it's supposed to be doing, which is clearing cholesterol from the blood. And therefore, if people don't have these genes working to clear that cholesterol, it leads to high cholesterol levels that circulate within the blood.
FH is different from the average high cholesterol in that we see in the family high levels of the LDL, and most often we see early heart disease, cerebral disease such as stroke, or peripheral vascular disease, disease of the leg vessels. Patients with FH need to be treated differently than the average person with a cholesterol problem, in that lower for longer is best. We want to prevent cardiovascular disease. So not only medical therapy, lowering the LDL, but also a good lifestyle. We encourage family exercise. We encourage heart-healthy eating. You should meet with your primary care provider and make sure the non-genetic causes have been ruled out. You also should speak to your family members and get a good family history, looking at stroke, clotting, heart attack, peripheral vascular disease, and present that to your primary care provider to get it in your chart, and that way you can discuss with other family members to make sure they get tested.
If you have any questions, please reach out to your healthcare provider. And on behalf of Geisinger, thanks for joining us today.